Hi, this is Dr. Faisal Dosari, Corneal consultant at Military Medical City in Riyadh, Saudi Arabia. I'm going to talk in brief about ectasia detection by the assessment of corneal biomechanics. Since mid of 1960, the development of biomechanical concept was started, and it has contributed significantly to understanding anatomical human behavior and the effect of diseases or injuries, as well as its response to treatment. The biomechanics of the cornea affects its functional responses and greatly impact vision and the visual functions in general. The physical composition of the cornea gives its viscoelastic properties, which means the cornea can exhibit elements of both elasticity and viscosity. An understanding of corneal biomechanics is fundamental to the diagnosis and treatment of corneal diseases. Measuring biomechanical properties in clinical practice is currently one of the most exciting fields in modern ophthalmology. The application of measuring these features in clinical practice are numerous, since several diseases such as keratoconus and the origin in the changes of biomechanical properties. The early diagnosis of corneal ectasia is of foremost importance in both screening for refractive surgery and the early treatment of keratoconus. Topography and tomography analysis using either video keratography or optical coherence tomography instruments can help in detection of alteration in the shape and the early changes of the cornea, such as thinning of the center cornea or the increase of curvature. However, morphological changes considered as secondary signs of primary structure or biomechanical abnormalities. Roberts and Dobbs have proposed that there is focal biomechanical failure in ectasia rather than generalized weakening, which causes a cycle of biomechanical decomposition leading to the well-known topographical changes. Theoretically, corneal ectasia could be therefore first detected based on corneal biomechanical properties. For this reason, there has been increasing interest in developing instruments to measure the in vivo biomechanical properties of the cornea to aid in diagnosis of ectasia in the biomechanical stages. Uh, there's two instrumentation or two devices that can measure the biomechanical of the cornea. First one to be developed was the ocular response analyzer, which based on the an analysis of corneal behavior during bidirectional applanation process induced by an air jet. This is the signal diagram obtained with the ocular response analyzer in a normal eye. The solid line represents the applanation signals and the dashed line representing the pressure changes. As shown, the device delivers to the eye in a picture of air pulse, which causes the cornea to move inward, achieving a specific applanation state or flattening, which is the pressure one. Milliseconds after the first applanation, the pressure decreases and the cornea passes through the second applanated state, which is the pressure 2, while returning from the concavity to its normal convex curvature. Analysis of the parameters produced by the infrared waveform signal allows the calculations of several useful values. First value is the corneal hysteresis, which is the difference between the two pressures, P1 and P2, and it can be produced by various combinations factors like the corneal thickness, corneal rigidity, intraocular pressure, or the corneal hydration. The second value is the corneal resistance factor, which measured by the aura and is derived using the formula of P1 minus KB2, where the K is the constant. And this constant was developed through the empirical evaluation of the relationship between P1 and P2 and central corneal thickness. Regarding corneal ectasia, several studies have demonstrated that corneal hysteresis and corneal resistance factor are significantly reduced in keratoconic eyes compared with the normal eyes uh, and healthy corneas. Despite this fact, the corneal hysteresis and corneal resistance factor have been demonstrated to be poor parameters for discriminating between mild keratoconus and normal corneas. The capability of the aura to diagnose keratoconus was tested in several articles but never reached the gold standard. The second device introduced for corneal biomechanics is the Corvus ST, developed by Oculus from Germany, and the Corvus use an ultra-high-speed shine flow camera which captured more than 4,000 images per second using a maximum pressure of 25 kilopascal. This device is approved for IOP and pachymetry measurements. So you can choose either IOP mode or pachymetric mode, as you can see here. Nowadays, this machine can provide more features of corneal biomechanics. During the dynamic corneal response, DCR, three moments in time are of major interest. After the air pressure, there is a three moments, which is the first applanation, when the cornea is flat, then highest concavity moment, in which the cornea is reaching the maximum concavity state, and the third moment is the second applanation, when the cornea is flat again before it returns to the origin states. From these three moments, rest of DCR or dynamic corneal response parameters can be analyzed. The problem with these devices, it does not providing an automatic analysis of corneal biomechanics in the beginning until years of 2016 when the Ricardo Finseguera and his group developed a new biomechanical index. The aim of this index is to separate keratoconus eyes from normal ones, which is the Corvus biomechanical index based on different DCR parameters. The study recruiting 658 patients, and the study was multicentric retrospective study, and the patient divided into groups, keratoconus and normal eyes group. All the subjects were examined by Corvus ST only without tomography evaluation to evaluate the DCR parameters. Then linear regression analysis was employed to determine the optimal combination of best predictors from the individual indices for the creation of Corvus biomechanical index. For the accuracy for the accurate separation between normal and keratoconic eyes. And they came up with the cutoff value of around 0.5. This is the display, provides a value and standard deviations, and you can assess the CPI value as you can see here. Finally, this study introduced the CPI for keratoconus diagnosis, which was shown to be highly sensitive and specific alone. So no tomographical evaluations to separate healthy corneas from the ectatic one. The presence of an external validation data sets from another continent confirms these findings and suggests that possibility use of CPI in everyday clinical practice, together with the topography and tomography to aid in diagnosis of ectasia. In 2017, Renato Ambrosio, with almost the same group, they published this study. And the purpose of this study was to develop a combined parameters based on tomographical data and biomechanical one to advance the ability to detect the clinical and subclinical ectasia using a pentacam and the corpus ST. And they came up with a new index, which is the tomographic and biomechanical index, TBI. This study recruiting 850 patients, and the study was multi-center retrospective study, and the patients divided in 4 groups. Group 1, normal eyes, and group 2, keratoconic eyes, and the group 3 and 4 is a very asymmetrical ectasia group that had one eye with a clinical or tomographical ectasia, and the other eye is completely normal. All the subjects evaluated using the Corpus ST and Ventacam HR, considering the combined parameters were programmed to have their output values as a continuous numbering ranging from 0 to 1. Then a linear regression analysis was created using only the bad D as the input parameter to calculate the Bellin-Ambrosio deviation normalized index, which is bad DI, to facilitate the comparisons. And finally, they came up with a TBI with an optimization of cutoff value to 0.29 with a high sensitivity and high specificity. This is the display of TBI, provides the values of bad D and CBI as well as the TBI as you can see here. In conclusion, the TBI is a combined parameter the combined parameter based on Scheimpflug-based corneal tomography and biomechanical assessment. It was accurate for detecting ectasia compared to other topometric or tomographical and biomechanical parameters, with high sensitivity for detecting subclinical ectasia among eyes with a normal topography in patients with very asymmetrical ectasia. Thank you.